Camerata.
Thank you.
Fox News Alert now back in the hot seat she goes. Kathleen Sebelius delivers a progress report on Obamacare. That's where we start today. Welcome to HQ. I'm Bill Hemmer.
Great to see you, Bill. I'm Allison Camerata. The latest enrollment numbers are in, revealing just 1/3 of the amount of enrollees expected by now. Some House lawmakers were visibly frustrated.
Knowing what you know today, you would have started the launch October 1st?
I would have probably done a slower launch, maybe with fewer people, and done some additional beta testing.
Who is going to guarantee that the doctor that sees that patient on January 4th is actually covered for that visit?
The insurance company that, as they do today, you are enrolling in a private insurance plan.
What
you
if
have
that
to pay your
patient
premium
doesn't
in order
make
to be
the
covered.
premium payment? You said they're covered December 23rd, but they never write the check. They never make the payment.
Then they're not covered.
You know, this whole idea of, you know, the president saying if you like it, you could keep it. I mean, the president didn't say that if you had a lousy health insurance policy that didn't cover everything, that he was suggesting that, you know, insurance companies continue to sell it and therefore you buy it.
You cannot say, as you had numerous times, that these preventative care services are, quote unquote, free of charge, can you?
They are free to the consumer, yes, sir.
They are not. There is no free lunch, Madam Secretary.
North Carolina Congresswoman Renee Elmers was asking some of those questions today. Congresswoman, thanks for being here. Great to see you.
Good to be with you, Allison.
What did you learn today?
Well, unfortunately, a lot of more of the questions that we go into, now I have more questions. You know, we aren't getting any reassurances of how come January 1st all of this will be paid for. You saw the Secretary take the opportunity to once again put the ownership on the insurance companies for who will be paying for these things. Will our doctors be paid? Will there be coverage for those individuals who think that they have purchased health care plans? You know, as you pointed out, we have a couple 100,000 that have enrolled in coverage, but yet we have over 5 million who have had their health care plans canceled.
Yeah.
So this is just very, you know, the numbers don't add up.
I want to get to those numbers because Secretary Sebelius today testified that as of November 30th, 365,000 people selected a plan. Those are her words, selected a plan. Do you know exactly what that means? Are they fully enrolled? Have they paid their money?
No, and that's exactly the point. As she pointed out, and as my colleague Dr. Burgess was asking very plainly, if these first payments haven't been made, then that means that there isn't coverage. Who is ensuring that? That, you know, there again, now we've opened up yet another question, another area, another gray area essentially where this is concerned. We end up walking away from these hearings with the Secretary with more questions than answers.
Right, it's not supposed to work that way. So where do you go from here? I mean, how will you, if you can't get the answers from Secretary Sebelius, who's spearheading it, what will you do?
Well, we are continuing to stay on this issue. We keep highlighting our constituent situations. I have a mother of 2 back in North Carolina whose health care coverage is going up $4,400 a year, and she makes about $40,000 a year. How can we continue this? I think the best Christmas present we can give the American people at this point is a delay of Obamacare. I think we can give the American people some assurances at Christmas time. For my constituent with 2 children, she doesn't know how they're going to have Christmas.
But is there any groundswell of support for that? I mean, we hear a lot of people, Republicans, talking about a delay of Obamacare, but it's already in place. So,
well, exactly. I mean, we even passed it to avoid the government shutdown. Let's just delay it for a year so that we can work these things out. You know, we continuously ask these questions. You know, I asked her very, very plainly, you know, the president said if you like your doctor, you could keep your doctor, period. You know, are you going to reassure the American people now, today, that they can keep their doctor? And of course, she couldn't do that. So you see how this is playing out. This is not good for America. This is very bad for health care. This is not good for the economy. And we've got to come up with an answer here. And we, of course, have passed that legislation to keep your health care plan if you like it, and a delay.
Congresswoman Renee Elmers, thanks so much for giving us your take on today's hearing.
Thank you, Allison.
We also found out today Secretary Sebelius says she will ask for an inspector general to investigate the rollout and development of healthcare.gov. This almost 2.5 months after the website launch. Chris Wallace, anchor of Fox News Sunday, here on that. And Chris, good day to you. I guess better late than never. What do you think of the IG move?
Well, it's a classic Washington move is what I think, Bill. We've seen it in the White House before and with other presidents as well. We're seeing it with Kathleen Sebelius. When you get in trouble, you announce an investigation, and now you can hide behind that and say, well, we have the IG investigating it, and we'll see what they find.
Is that a way?
It's a good way to sort of diffuse some of the attention and to delay things for a while.
Is that a way to not answer the questions, Chris? Is that the age-old tactic?
Yeah, well, eventually you got to answer it, but you put it off and you say, look, I'm as concerned as you are about it. I have an inspector general, an independent person investigating it. We'll see what they come up with. We certainly remember the Accountability Review Board on Benghazi. Yeah. Same thing.
She came out with a number today. Approximately 365,000 have signed up. Not enrolled, not spent money, but signed up. They had expected at the end of November 1.2 million. They expect by the end of December, based on their estimates at the rollout, 3.3 million. They're about 25% on the sign-up list. I mean, you forecast that down the road. Wow, are they behind?
Yeah, they're way behind. I would say this, though, that obviously you're talking about the first 2 months when the website didn't work. By all accounts, it's working better and traffic is way up. In the end, they're going to get the website working properly. I don't have much question about that. But I do have questions, and they're similar to the ones that a lot of those congressmen were asking Kathleen Sebelius, which is one, coverage, because the front end, the signing up part of it, is going to work eventually, and I think sooner rather than later. But are they going to be actually have the money transfer, the payments, so that come January 1st, you'll actually have coverage? And then another issue, and this gets to the if you like your doctor, you can keep your doctor. A lot of these plans that Obamacare is offering, we had this conversation with Dr. Ezekiel Emanuel over the weekend on Fox News Sunday. They're writing out a lot of, by networks, writing out a lot of the doctors, a lot of the hospitals. So you may not be able to keep the doctor you've had for all these years. You may have to go find a new doctor and a new hospital, and they may not be to your satisfaction.
And pay more, too. And, Chris, I thought it was so revealing, and we've played the clip several times since Sunday. When you asked him, is it true or not, and you had to repeat yourself over and again. I haven't had a chance to talk to you until now about that. But what he conceded is that, yes, Chris Wallace, you can keep your doctor. You might have to pay more, but you can keep that doctor. What did that tell you?
Well, what it says is that there was fine print. And remember, the president didn't tell us there was fine print. He said you can keep your doctor, period. End of sentence, end of fine print. But it turns out now, as you say, that, well, you may have to go out of network and pay a lot more. And, of course, we're also finding out that even sometimes when the premium is low, the deductible is huge. And, look, if you don't have a lot of money, and you heard that from Congresswoman Elmers, and you've suddenly got a $3,000 or $4,000 or $5,000 deductible, that means you got to pay that before you get a cent of coverage. So, yeah, your premium's low, but that doesn't help you out of pocket.
I don't know if you saw this in the Wall Street Journal polling, but among those who do not have insurance, back in September, according to their polling, only 34% disapproved of Obamacare. That number today is well over half. Well over 50%. I don't know what it suggests to you, but those are the people who are on the website. They're asking questions. They're discovering these deductible charges. They're finding out that doctors and the networks are more limited than they would ever think. And that number continues to go high with the disapproval of Obamacare. I don't know how that changes in the new year.
Well, they got to get the system working better. If it's going to work better, there's a lot of question as to whether it will. I mean, what I think is that those people and Obamacare in general has been mugged by reality, that the reality doesn't meet up with the promises that were made, whether it's about coverage, whether it's about doctors, whether it's about deductibles and premiums and cost. And people are learning that the gauzy promises that were made before Obamacare was launched aren't what their experience is going to be. They're either going to have to fix this, or this is going to be a continuing problem, scandal, as we head up for the election in next November. You're precisely right
about that. Chris, it's great to see you. See you on Friday. See you again on Sunday. Chris Wallace.
You bet.
In Washington. Allison.